We have different filling material. You can see here in this slide the amalgam material. This is a dark one. This is the composition of different metal material. And you can see the mixture, a mixture of silver, tin, copper, and mercury. Because of the dark color, it is suitable for posterior teeth actually. However, we have some patients that didn't want this kind of material even for posterior teeth. They prefer to have tooth color filling, for example. Amalgam have some disadvantages. For example, the dark appearance and also some concerns about the mercury content. But it is safe for using in dentistry. The concerns are most about the, for example, environmental health, about the water pollution or air pollution. Some kind of concerns is here because of mercury content. And we have tooth colored materials. You can see here dental composites. They are resin. And they can use especially for anterior teeth because of the aesthetic characteristics. And the advantage is the tooth colored appearance, and the disadvantage are two main area. For example, the technique sensitive use of this kind of material because they are so sensitive to moisture and also the saliva. And if we have uncooperative patient, to control the saliva and to control the moisture, we can't use this kind of material because it is necessary complete control of moisture. And also because of technique sensitivity, this kind of material have some failure due to recurrent decay, actually. Oral hygiene is very important in case of composite filling. And what is this? This is dental laminates. Dental laminates are porcelain veneer, actually, a thin layer that covers only the surface of tooth and generally used for aesthetic procedures. This kind of treatment is somehow expensive because of laboratory process and also because of the type of material that we can use. This is a kind of porcelain, and but this is, you can see here, very beautiful and very aesthetic. In operative dentistry, we have another service that is named dental bleaching. Do you have any idea about that? Dental bleaching, whitening, tooth whitening? Yes. Some kind of material used for color change, actually. This
changing the color of the piece, bleaching. After bleaching, this is the natural color of the piece, or this is some materials for pieces.
No. We can use some special tooth whitener materials, and it's used on the surface of all of the teeth, for example, and they can remove all stains on the surface, on the outer layer of the enamel, and the tooth became more whitened, became more brighter, just for a limited time, for example, 6 months, maybe fewer than this time, but this is depend on your diet. Persons with habit, for example, to consume so much, for example, tea or coffee, this material can deposit some stain on the surface of the enamel. However, this is the conservative choice.
And bleaching also is for health use, right? Not,
Yes.
this has energy or
It can be used for this purpose. For yeah.
but here it can cause the health use or
No, can use it. Can use it.
Professor, after bleaching, it looks like a natural thing or maybe
Natural. Yes,
because
natural.
sometimes when we do like this, it becomes dark white, and we can see that they have done some treatment with their teeth. It doesn't look like a natural thing.
Tooth whitening leads to a natural appearance actually. Your special enamel of your teeth actually. You know, if we want to make it, for example, very some kind of, for example, Hollywood smile, and they are very white, very bright teeth. Actually, they use some other kind of procedure that we can be said about that. This is dental. These are dental laminates actually. Somehow it make unnatural actually appearance. But tooth whitening lightens the color of the tooth and can be achieved by either changing the intrinsic color or removing and controlling the formation of extrinsic stains that I said before.
As bleaching effects on the teeth, right?
No, just we can provide some support for gingiva during the procedure. Some kind of plastic insert on the gingiva, and it can protect the gingiva from the whitening materials. Okay, about the pediatric dentistry. This is the variety of services that provide for children from the birth to, for example, 12 years old. In this department, we concern with the preventive and therapeutic oral health care of children from birth to adolescence, and more services on prevention and oral health instruction in this age range. The department have some unique difference from other departments because of methods of behavior management. Because we have some children with different age, with different modes, and we should control their behavior to provide the treatment for them. In this department, the range of the services are varied from complete oral examination, preventive services. For example, we have fissure sealant and fluoride therapy. I will explain more about this kind of preventive services. And we have dental restorations, different fillings and full coverage, root canal therapy, and aesthetic restorations. You can see here, the top of the slide, you can see fissure sealant. There are some kind of deep fissure on the posterior teeth, for example, that they are susceptible for dental caries. So we can fill these fissure with some kind of resin, tooth color filling that prevent that the goal is prevention tooth decay here inside the fissures. And here you can see the fluoride therapy procedure. Fluoride is have some different shape, for example, foam or gel, and we have fluoride in toothpaste also. The common method of receiving fluoride. And in dental office, we can provide fluoride in these different kind material. For example, you can see here fluoride foam. This is fluoride varnish that paints on the tooth. And what is the benefit of fluoride for controlling the dental caries? Do you know anything about that?
For preventing caries and for repairing the teeth. That's why.
The ion, fluoride ion, go through the enamel layer and make enamel more harder and more resistant to acid produced by microorganisms. So it can be used for caries prevention. Here you can see full coverage of primary teeth. The material is stainless steel, and this is a very good and very beneficial material for tooth filling in primary teeth. Actually, you can see here
Fisher sealant.
Fisher sealant and some kind of tooth color filling on the occlusal surface of the teeth. We have some aesthetic restoration also in primary teeth. In anterior region, especially, you can see here. And the last one, root canal therapy in primary teeth. We can maintain the primary teeth by this procedure till the normal exfoliation time. So the function would be normal, and also the arch length. It is important for us. So by this kind of treatment, we can save the tooth until the exfoliation time. Here you can see some special kind of coverage. This is a bicarbonate crown that it is filled with composite material and inserted on the crown of the primary teeth. And after that, we can cure it by some special device. You can see
Light.
Light cure
Light
device. And after that, we remove the this layer of the bicarbonate coverage. So we have a very beautiful crown here in anterior teeth. In pediatric dentistry also we have some another kind of services, for example emergency management of dental trauma and some kind of oral habits interventions, for example night guard or mouth guard. What is the difference between night guard and mouth guard?
Night guard for night,
Yes,
for preventing
dental grinding. Yes,
and grinding,
yes.
and mouth guard for after ortho, I think. After ortho you use.
Mouth guard. This is for preventing the dental trauma, especially in sports, high contact sports, for example, boxing, martial arts, also
right.
taekwondo, karate, and other kind of martial arts. Yes, thank you. Also, we have preventive orthodontic treatments, tooth extraction and space maintenance. I will speak about that. Children with special health care needs and dental treatment under general anesthesia. The top of the slide, you can see dental trauma, different kind. Most of the children that they are injured by trauma, by dental trauma, are at the age range of 9 to 12, for example. So they are patients that refer to pediatric dentistry department. We have to manage these patients with different kind of treatment, and also we have
Open bite.
oral habits in children. For example,
Open bite.
open bite. This slide is
Understand.
open bite. You can see here. Can you see?
Yes.
Oh, this cursor, yeah, here. It is open bite that it is made by, for example,
sucking.
thumb sucking. This is a very common oral habit in children under school, in pre-school children actually. This is mouse guard. This is mouse guard. For children that they are professionally have some kind of sports, and we have preventive orthodontic treatment also. This is some appliances, orthodontic appliances that can use by patients to, for example, align or to align the tooth or to expand the palate. And what is this?
Retainer.
Yes, a space maintainer. As abbreviation, we can say it SM. A space maintainer is an appliance that custom made. And it can be either removable or cemented in a child's mouth. These are in these two slides. These are fixed, that they are cemented on the teeth, you can see. Different shape, different goals from design this kind of space maintainer. And the purpose is to keep the space open to allow the permanent tooth to erupt and come into the space. And we have special needs patients. For example, what kind of special health needs here?
Down syndrome.
Down
syndrome.
Thank you.
Disabilities.
Cerebral palsy, yes. This is cerebral palsy. And also we have very young children that they are unintegrated in the industry. So we have to bring them to, for example, general anesthesia and also sedation in some situation. That they receive dental treatment under these modalities. And endodontic departments. What is the goal in endodontic department?
For
You can see the picture.
dental care.
Pulp treatment.
Yes.
Actually, this is about pulp treatment. This department concerned with the diagnosis, prevention, and treatment of diseases and injuries of the pulp and associated peri-radicular tissues. I guess you said about RCT or root canal therapy. Yes? Root canal therapy is used to prevent tooth extraction actually. And this is the radiographs of a root canal therapy. You can see some white material that filled the root canal. In some special situation, which the carie is progress inside the pulp space, for example, we have some special signs. The pain. Some special characteristics of this pain makes us alert to receive some special treatment from endodontic treatment actually. When the pain is severe, spontaneous, and also permanent pain with nocturnal pain. Nocturnal pain, what is the nocturnal pain?
Nocturnal pain.
Do you have any idea? Pain at night? Nocturnal pain, what is the meaning?
Is it pain at night?
Yes, thank you. The pain that would be through the sleep at the night. These characteristics show that the teeth needs RCT. So we can provide this kind of treatment for the patient, and also we can see some signs inside the mouth. For example, very large decayed tooth or some kind of abscess in the gingiva, and also some situation we have a very life-threatening situation here. You can see the swallowing the cheek of the patient. It would be very dangerous. The question you have.
After connectivity, we have to cover the
Yes, it is better to full cover the tooth by crown. Yes, it is better. In this situation, that I said that it is very dangerous, we should refer the child or the patient as soon as possible to the hospital for drug administration. For example, different kinds of antibiotics that should prescribe for the patient. Here you can see different stages of RCT or root canal therapy. We should remove all carried tissue, and then by some special instruments here, the name is file, with different size, with different lengths, to remove the all necrotic tissue from the root canal, and then fill it with a special kind of material. The name, the pink material you can see here. The pink material, it is a special plastic material named Gota Perca. And after that, the crown should be covered or should be filled. As I said before, the full coverage is better for these teeth. About the department of periodontics. This is about the periodontium. What is the periodontium? The bone and the other?
Gingiva.
Gingiva, yes.
Yes.
PDN, periodontal ligament,
Yes.
you know?
Yes.
Yes, and the cementum. Periodontium is a mixture of 4 different tissues. Okay, the Department of Periodontics concerned with the diagnosis and treatment of disease of the supporting and surrounding tissues of the teeth. As I said, periodontal ligament, gingiva, cementum, and alveolar bone. We have in a healthy gingiva, we have a free gingiva that the depth is about 2 millimeters. So, in case of good oral hygiene, the gingiva would be pink colored and would be firm, and we have no bleeding during, for example, toothbrushing. But if the oral hygiene became poor, you can see this appearance. The red and swallowed gingiva is bleeding easily, for example, during toothbrushing. If the oral hygiene not became optimal, so the disease would progress to more advanced disease that we named it periodontic. And this situation consists of, for example, involvement of bone. So after a while, the bone would be lost. You can see here in the radiograph. Where is cursor? Here. In radiograph, you can see bone loss, this dark area, and it leads to tooth loosening. And the clinical appearance is, for example, long crown of the teeth because of bone loss. And what is this? The hard tissue deposit on the tooth surface. What is the name of this condition? No, palate is soft. This is hard and calcified by the ions from the saliva. This is calculus or tartar. Okay? And it needs to remove because if remains here, it leads to recession, gingival recession and bone loss. So we should remove this kind of tissue from the site by some special kind of device or, for example, instrument. We have ultrasonic, that the name is Cavitron, and also we have some special instrument by hand that the name is scaler.
Scaler.
Okay. The next one is oral and maxillofacial prosthodontics. It is about the replacement of the different, for example, tooth loss, or for example, some parts of face, for example, or colleague in this department can actually rehabilitate the function and the appearance of the patient. And as I said, this department concerned with the restoration and maintenance of oral function by restoration of natural teeth or the replacement of missing teeth and adjacent oral and maxillofacial tissues with artificial substitutes known as prosthesis. You can see here fixed prosthesis. If we have just one
Crown.
for example, carrot tooth, we can rehabilitate or restore with a single crown. The material is porcelain here. And also we have dental bridge. It is also fixed. You can see two teeth, both sides of the missing teeth. And the missing teeth would be replaced by a crown here. And these three crowns named dental bridge. Both of them are fixed prostheses. And also we have removable prostheses. Complete denture, as you can see the top of the slide, and partial denture.
Beside this used for the bridge is healthy teeth or loose one?
Maybe healthy, or maybe, for example, teeth that they have some kind of fillings, for example. Both of them possible. Okay. Complete denture, partial denture. They are removable. And also
Implant.
crown for dental implants. They are prepared in periodontic department. And also we have some patients that they lost, for example, some part of the face because of a tumor or, for example, trauma during the surgical process, and they need to repair this part of the face, for example. These prostheses would be prepared in this department. And with some special kind of implant, they are fixed on the face of the patient. Okay. I guess you said this wire before. What is this? Braces, yes. That they aligned the teeth in orthodontics department. So, this department concerned with the supervision, guidance, and correction of forms of malocclusion of the groin or mature dentofacial structures. Both for correction of teeth irregularities or correction of facial irregularities. You can see here crowded teeth. These arcs, both arcs, have a space deficiency for teeth, and also here you can see canines in upper jaw and lower jaw that they need some special space. And also you can see here the retruded position of mandible here. So it is a facial irregularity. Who is he? Who is he? No, actor. Tom Cruise, yeah. You can see the midline. Midline, what is midline?
Midline. This line for body.
This is an
Sagittal.
imaginary line that both sides of the face should be completely similar
equal.
to each other. So the face midline should be
Fit.
should be also the tooth midline. Okay, so you can see here the midline is off because of a tooth missing, congenital missing. I mean, okay. If we have a tooth missing, the tooth midline migrate to the
Shift.
yes,
This side.
shift to one side, and it is not aesthetical from the orthodontic point of view. So it needs correction, especially for upper jaw.
Redness of the gland is normal.
Where?
The upper jaw.
Upper jaw, here,
No, lower jaw.
lower
The
jaw,
redness.
the color of the tooth, the color of the gingiva, it is normal. Yes, it is normal. You can see here deep bite, full coverage of lower teeth by upper teeth. Okay, this is malocclusion, a kind of malocclusion. It needs deep treatment also. Here we have cross bite. It means that the upper jaw is cross the lower jaw. Yes, it is a kind of malocclusion. We have open bite. As I said before, the open bite mostly produced by
Sucking.
tongue sucking, yes, especially for example for school children or preschool children. We have unilateral crossbite. Can you see? This side is normal, but the other side is
Abnormal.
anormal. You can see it. And we have also general spacing. This is a kind of malocclusion that needs treatment. And about facial irregularities. In a normal profile, the profile should be straight completely. We named it the right one class 2 malocclusion, and the left side
Class
it is class 3 malocclusion. The normal occlusion would be class 1. Both of them need treatment. maybe by appliance or maybe in some situation we need orthogenetic surgery. The next department is oral and maxillofacial surgery. Different kinds of services are provided in this department, and the department concerned with the diagnosis and surgical treatment of disease, injuries, and defects of the oral and maxillofacial regions. For example, extraction of non-restorable decayed teeth, extraction of impacted teeth, for example, wisdom teeth, periprosthesis surgery for patients that, for example, have some kind of bone loss, tooth extraction due to orthodontic reasons, extraction of residual roots, cyst and tumor surgeries, biopsy, jaw fracture, jaw reforming. In case of cleft lip or palate, some special surgery need, and they can do that, and also dental implants. You can see in the upper slide, you can see the surgery for wisdom tooth, and most of the surgeries are done in hospital actually in this department. So some services would be provided inside the hospital of the dental school. And about the Department of Pathology. The department provides diagnosis and studying of causes and impacts of disease involving mouth, jaws, and face, and concerned with the nature of disease. Usually they do biopsy, and the process would be done in laboratory process. And after that, they can diagnose, for example, different diagnoses with the special lesions that removed by surgery to examine. And the Department of Radiology, it's concerned with the production and interpretation of images, diagnosis and management of disease, disorders, and conditions. We have different kinds of radiographs, for example, intraoral radiography. We have periapical or bite-wing radiographs. We have also panoramic view, and we have CBCT, cone beam CT scan, with different
or OPG.
Balls with different
OPG.
OPG, the name of panoramic view, Panorex, yes. This is a periapical radiograph.
What is the OPG abbreviation?
OPG, this is the name of a special brand, actually. Yes. The scientific term is panoramic view. This is the device that for panoramic view, and this is the radiograph of panoramic view, a broad spectrum of all of the teeth or some parts of jaw. And also here you can see intraoral radiograph with a special device produced periapical radiograph or bite beam. In bite beam, we have a radiograph from both teeth, upper and lower jaw, just for crown part of the teeth. If we want to check the tooth roots, we should prepare and provide some periapical radiograph. And also we have CBCT, cone beam CT scan, a special new device for oral region. For example, in some special situation, traumatized teeth or a tumor or some lesion inside the bone to localize the lesion, or for example the direction of displacement of tooth due to dental trauma, we should use this kind of radiograph. It is very helpful for surgery, to guide the surgery. And oral and maxillofacial medicine. It is the first department that patients be referred to it inside the dental school. And or do a complete oral and maxillofacial examination, maybe radiographic examination, and then they diagnose and screen oral complications. After all of them, the patient referred to oral and maxillofacial pathology in case of, for example, oral lesion, and maybe they prescribe some medicine, for example, for oral lesion, and also they consultate with the other departments. For example, the special service that provided in this department is about the diagnosis of oral lesions. For example, you can see optus-like scar here, you can see a leukoplakia here, and also we have a mucocell. It is induced by accumulation of saliva under the soft tissue. And the last department, except dental biomaterials. Dental biomaterials just they have some theoretical subjects with you, and no special clinical department. So we jump to the last department, community oral health department. Do you have any questions? In community oral health department, we concerned with preventing and controlling the diseases and promoting dental health through organized community force. And this is new, this specialty is very new, and the goal is providing, maintaining and promoting oral health, prevention of oral diseases, and promoting of quality of life. The specialty we use to assessing oral health needs of whole population instead of just a person. For example, we have some special programs inside a school, for example, or for old persons, for example, in some special locations. Or maybe we have some special programs for pregnant women. So we targeted a special community instead of just a patient. You can see here some exercises, for example. We targeted preschool children, school children, patients with special healthcare needs. We had some programs about, for example, autism patients, or for example, disabled patients, and also pregnant women, elderly people. And as I said, the dental biomaterials department is a science of dental materials and defined as the study of composition and properties of dental materials and the manner in which they interact with the environment in which they are placed.